Welcome back to our first community talk session for the year 2025. We closed out 2024 by focusing on resilience and anti-fragility with people in mind and people being the focus and as a fundamental element of the communities. We are going to link the community resilience concept with the health concept in mind. We believe that by focusing on the individual resilience, we can collectively strengthen our community against both known and unknown challenges. In line with this, we are turning the attention to health sector today. What new trends in healthcare can truly help us prepare for the uncertainties of the future? Today, joining us, Dr. Amir Fazil. Dr. Amir comes with over 15 years experience in the healthcare sector with focus on the regenerative medicine. Dr. Fazil chairs the regenerative medicine department and the head of the family medicine in Yas Clinic managed by Abu Dhabi Stem Cells Center. Welcome today, Dr. Fazil.
Thank you very much for your kind introduction. It's an honor for me to be here sharing this platform with you today. It's an interesting, topic for today, the resilience in the community, and it brings us to how we link it with healthcare sector, and the modern health is about the 360-degree holistic care, integrated care. So today, I hope we can chat about it, and the viewers can get some positive impact on their lives as well out of this discussion. Yeah.
Thank you. Before we get into the details of how we can build more resilient communities, can you tell us more how Yas Clinic actually works, and what is Yas Clinic and what they do in the new modern healthcare trends?
Again, it's an honor for me to represent my organization. So, Yas Clinic is an 85-bed hospital with doctors and trained all over the world. We have representation across the globe, from US, from UK, Australia, Europe, India, Pakistan, and we have a strong workforce of specialties. So it's a full-fledged hospital, 85-bed, and including urgent care centers, intensive care, and we are the center of excellence for bone marrow transplant in UAE, and that's a really prestigious honor. This hospital is unique because this hospital as an entity is linked with Abu Dhabi Stem Cell Center, managed by Abu Dhabi Stem Cell Center, which is the state-of-the-art stem cell lab. There are international certifications, so there is a GMP certification, FACT accreditation. So it is a stem cell lab which is working and pioneering stem cell research in the MENA region. And we have a really talented group of scientists in molecular biology, in stem cells, and different individual super specialties. And we are processing cellular therapies and applying the clinical application based on the evidence. So the hospital and the lab work closely with each other. And it's a unique combination. I think it's unique in the world as well. Probably we are the only organization with such capabilities.
Beautiful. Dr. Fazil, in our aspiration to build resilient communities, we are starting at the individual level. So understanding what we know, and what we don't know we know, connecting to the healthcare, what are some of the most important new trends in healthcare that can help us build individual resilience, and starting with the fundamentals of well-being.
So for well-being, I think we should start from the basic foundation of health, and as per WHO definition, well-being and health is a combination of physical and mental well-being. The approach is that as a clinician, our job is to diagnose condition and treat them. But when we look at a patient, we should focus on holistic and integrated care. That means that it's not just the disease walking in the door. It's a human with lifestyle issues, with maybe stresses, and then decades of sometimes our lifestyle can affect and cause chronic conditions. So those conditions affect us to molecular or genetic level. So the modern health concept is of personalized medication, and that's where today I would be happy to discuss and about how how far we have come, how the future is here, how genomics can play a role, and how stem cells can help the body, to utilize its own healing abilities, and that's the definition of regenerative medicine.
Exactly. And if we start with nutrition, what would be the advice for our residents, like starting from the basic of nutrition?
So, as a family physician, this is my bread and butter is being a family physician, looking after patients, being a diagnostician, approach to identify a disease early. So, your question is quite appropriate. I think this, if we prioritize nutrition, is one of the key element in the lifestyle which can be modified to gain the maximum health benefit. So, to have a healthy lifespan, so which is increasing the quality of life and reducing the number of years we live with chronic conditions or disability. So the key component, one of the key component is nutrition. In nutrition, I think it's a known that healthy, natural, balanced diet is important. So we want to live well, and I know there is a interest in longevity, but how well we live for longer is important, and food plays a major role in that.
We eat, and then one of the major issues in today's busy environment is sleep.
Yes.
I hear a lot of people talking about, I have insomnia, I can't sleep. So how important is sleep to our general health?
Sleep is regenerative. So basically, we heal as we sleep. For both men and women, it's important. But there are some studies that suggest that there's a lot of hormonal imbalance that can happen if sleep is distorted. If we are sleeping, less than 8 hours, over the long period of time, it can impact. So sleep hygiene is very important for overall well-being, and as I said, it's regenerative in nature. So the body needs and the brain needs to rest and do some healing for the wear and tear and the stresses of the day. We are focusing on sleep apnea as well as clinicians. If someone comes with blood pressure, we try to identify if they have daytime sleepiness. There is a condition called sleep apnea, and it's quite common, and whether it's linked with how our anatomy is, how we are made, the throat can close on itself at night time. So people who snore a lot, they can have it, and we identify. Sometimes patients don't come in and tell us that they have sleep apnea. They may be diagnosed with hypertension. So when we see blood pressure, we ask them, and often we pick it up. So sleep can cause chronic conditions, and sleep can cause loss of concentration, focus, poor energy levels. So sleep hygiene is important in my day-to-day practice. And how our lives have changed due to gadgets, and lots of people use mobile late night, and the light from mobile affects our eyes, and the science is quite advanced. Now we know that when the light hits the retina, there are different wavelengths in the light. So for example, there is a specific wavelength in the morning. So when we look at the sky in the morning, so the cortisol is released, and dopamine is released, and those can give us energy and can help us wake up. Same is that when our lights are sensitive to white light at night time, so but yellow light, candle lights, or those are much safer. And in the dark, the body can help with the light exposure. The body understands whether it's day or night and produces hormones. So when it's dark at night, the body produces melatonin, which helps us go to sleep. So our lifestyle can affect our sleep, and again, as we discuss, it's going down into the molecular and hormonal level, how our environment is affecting us.
Wow. It's beautiful. This is the first time I hear that much deep analysis between sleep, hormones, and happiness.
Yeah.
Okay, so I'll sleep more. How about mental health? Another topic that is becoming very popular and widely discussed is mental health. Again, due to whether environmental pollution, food, how we can maintain, proper mental health and make sure that we are as productive as possible for as long as possible.
Yes, so I mean, this is in some cultures. Look, I've worked in England and Australia for almost 1.5 decades and more. So in Western world, it's almost not a stigma. People, when they feel stressed, they seek help. In UAE as well, I mean, this is one of the most progressive countries in the world. Honored to be working here and living here and calling it my home. But there are sometimes cultural sensitivities that patients do not come forward and accept that they are going to see a psychologist or talk to a doctor about their mental health or mental well-being. And anyone, be regardless of gender or what their position in life or what their wealth status is, life is challenging, and we can have periods of time when whether due to combination of factors, chronic conditions that we are suffering from, relationship issues, or a combination of small elements combining and augmenting it on our mental well-being, patients can undergo, and we as humans, we undergo anxiety and depression, and at some point all of us go through that. But when it's affecting the quality of life and day-to-day function, that needs a diagnosis and support. Often talking therapy, psychology sessions are enough. Mindfulness is key. Mindfulness is really a powerful tool, and the patient can analyze why they're feeling that way and what they can do about it. So in fact, stress is linked with longevity, and stress is linked with producing more cortisol in the body that can cause blood pressure to go up or can cause abdominal obesity, and there are links with heart disease as well. It's very common to see that mental health illnesses, patients on chronic suffering from chronic mental health disease, they have high risk of cardiovascular incident. So it's important that we look after our well-beings. And simple things, again, the knows are that diet we discussed about a little bit. I mean, we can spend an hour on nutrition, but sleep, diet, we will talk about exercise. They all contribute to a positive mental health. And then things that people, for example, how to manage stress at work, at home, and relaxation. There are things like hobbies and green areas and built environment, and that can also affect how we feel. So well-being is key, and without that mental well-being, it's not possible to have a good enjoyable life. So I think the message is there that when you identify a stress that's affecting the day-to-day function, early to get help, and then there is support available, and these things are treatable in most instances, and not every case needs medication.
Thank you. You touch base on exercise.
Yes.
And built environment. So exercise and how we can build a healthier body, and how the built environment impact.
If we talk about evidence base, this is how the research has shown. So I wanted to share a simple example. I think because the social media, everyone knows that we have to exercise regularly to keep fit, but actually the science has now quantified how much we need to do, at least in order to maintain health. So in UK, the guidelines are that you have to work out at least, with moderate exercise around 150 minutes per week. Okay, so that can be divided over 5 days. There's a very interesting study that shows that there's two group of people, so people above 40 years of age, those who walked 8,000 steps compared to those who walked 4,000 steps, they had 50% less chance of having cardiovascular disease. So there is a difference between 4,000 steps and 8,000 steps as well. So I think the minimum requirement to pass in this exam is to at least walk daily, and that's the minimum. But then I want to add on, because we want to focus on health span and longevity and how well we live. So I know I'm repeating, but that's important, because our focus for my organization is also on increasing the health span, so that we live well, and muscle mass, I wanted to touch on that. So after 50, there's an innate mechanism in our body, and so those muscles that we don't use, we lose them, and that's called disuse atrophy. So that's why it's important. You would see that footballers would train a different sport from time to time, and that's the reason, because they want to get all of their muscle group active. So I tell my patients normally to have resistance training. So moderate, sustained exercise is better than just going for it full on, and because that will cause a stress to the body and can increase the cortisol, and people can have abdominal obesity, even if they are suddenly started, and they are prone to more injuries. So I think moderation is good, balance is good. So for females, it's important, particularly above 45, to have weight bearing exercises, and particularly walking, because they are at risk of hashashatul adam, which is osteoporosis, weakness in the bone, because of the hormonal change, and for men as well. So I wanted to share so there was a study done that 55 years and above, um, patients were studied for a couple of years, and it was a very interesting finding, that they noted that muscle mass was a better indicator of longevity than the BMI, than the actual a parameter of weight and height that we do. So keeping muscle mass after 50 is very important for both men and women, and that increases our functional reserve, we call it, your potential to fight. For example, COVID-19 happened, so sometimes unexpected things can happen. God forbid, we all can have accidents and hospital admissions. So having a good muscle mass is important to have good functional reserve, and it can protect our knees and hip joints as well. So muscle tones are often helpful in keeping the pain from arthritis at bay, and so that's important. So
Yeah, and this is a common issue we have.
yes, so muscle mass and exercise.
Excellent. Screening. When we feel fatigue, or we do the annual physical, we normally get blood tests and some screenings done. So what is your take up on screening?
So that's important, and I would link everything with longevity and health span as well, because that's what we want, resilient communities. So early identification, early detection of disease is important. That's why there are internationally set screening patterns that the healthcare systems implement. For example, for women, it's pap smears regularly, mammograms, and I wanted to highlight here that this is something that should be done. If any family physician is talking about screening, they have to raise the issue of breast cancer. And particularly those families who have a strong history of breast cancers in the family, there is a gene that can be transferred, and that can increase the risk of having breast cancer. With the emerging health concept, as we discussed in the beginning, the genomic studies can help identify those genes that the patient is carrying, that can put them at risk of different cancers. So that can actually help identify screening intervals. For example, if someone is found to have a high risk of breast cancer, they may be needed to do more frequent mammograms than a person who had no risk factors and a normal result before. So that's for women. And for men, one of the key things for young men is to do self-examination. For men, it's important because there are certain things that can develop in young men as well. So there should be community education as well, then how to self-examine. And for older men, it's important to discuss with their doctors about prostate health, particularly those 45 years and above. And if there is some family history as well, there is a simple blood test that can be done, and that can be picked up early. Also, there is a test called fit test, in Arabic is dam fil burad test, and that is also important, particularly patients who have a strong family history or 50 years of above. They should do it regularly to make sure, because it's a subtle test. I know it's inconvenient to deliver those samples, but they can certainly identify cancers early, and early detection of cancer would mean increasing the health span, because the treatments are often less invasive and the chances of survival and full recovery are quite enhanced. So screening is key, and I think it's something that can be a collaboration between healthcare systems and communities and organizations together. And I think Abu Dhabi again is at forefront. We get regular events at state level promoting different type of screenings and highlighting these cancers from time to time.
Thank you. So that was a great overview on the fundamentals. Now, there are a lot of new ways of preventative. We see a lot of people going to the pharmacy, buying all these vitamins. What would be your advice? Is there such thing as vitamins overdose? Or what would be your advice for people, having trays of vitamins in their kitchens?
Speaking openly about it, my experience is different from UAE compared to what the clinical trainings and the guidelines are in UK and Australia. In fact, there was a huge difference between England and Australia as well. And as a family physician, I think I've been privileged to work in this organization, Yas Clinic ADSCC, because we have access to not just advanced vitamin testing, but also in genomics. So when we in general talk about vitamins, the amount of deficiencies I've seen in UAE in patients who have had bariatric surgery, I've not seen them in my prior experience. So lots of patients who had like this gas mather surgery, they suffer from chronic nutritional deficiencies, where this surgery prevented diabetes and heart disease. And because obesity is one of the biggest killers in human population, obesity is linked with cancer. So I think there is a big role of bariatric surgery. Now we have newer medications which are breakthrough and can help patients lose weight. But again, the key message is lifestyle is the most powerful version. But coming back to vitamins, so there is a lot of iron deficiency here. Vitamin D deficiency is almost universal. And I think the population here is highly educated in health concepts as well. So they understand and they frequently get it checked. So when you first are moved from a Western country to UAE, you feel like, this vitamins patients can buy over the counter. But I have learned and I've seen the effect of these, deficiencies, patients coming in with chronic fatigue or numbness in hands and feet, which is linked with B12. And when we are in medical school, we are taught about vitamin deficiencies linked with conditions. So doctors 30, 40 years ago used to see it before. Now it's rare to see an absolutely, severe symptoms with vitamin deficiencies, but they are diseases linked. So vitamin D deficiency can cause rickets and osteomalacia, particularly in children. They can have bowed legs or growth issues. But vitamin D is such a fascinating vitamin that it's immune modulator, helps in DNA repair. So patients who had severe COVID were found to have low vitamin D levels, and patients who are found to have cancer often are found to have low vitamin D levels as well. So I think it's important in as a regenerative practitioners, what we have learned in our approach is to keep the vitamin levels optimum. So at least average. So what happens is a routine physician, which I respect all my colleagues, would see a vitamin D level at 51 and would just say it's not marked as red, it's normal. But the patient may be feeling tired. So some studies say that you have to, symptoms start appearing at 70. So the levels should be at least in the middle or preferably close to the upper limit. Yes, there is something called toxicity. So vitamin D levels, if they are above 250, they can be toxic. So vitamin D is linked with calcium. So if the vitamin D goes really high, it can upset the calcium balance, and people, can have complications with high calcium. So which can give muscle pain or kidney stones. And so I think, of course, it's important to have a physician involved. And um, a healthy balanced diet would mean that humans would not need supplements, but I think if we have time we can discuss about the nutrient collapse, not just patients with bariatric surgery. So yes, there are malabsorption condition in which colon and stomach absorption of these nutrients is affected. But we have learned in regenerative medicine that as you grow older, your ability to absorb nutrients get affected as well. And I mean, it's an old Greek medicine. There's a wise saying that most of the diseases originate from the gut. And as a family physician, as we look into the emerging health concepts like functional medicine, which focus on the function of the human systems rather than just the disease. So um, the thing I was trying to explain is there are deficiencies in the modern food. Is it due to the industrial practices or genetic modifications? And and it's actually quantifiable. So there are some studies. I mean, there was a paper from early 2000s, and that estimated that from 16 to 20% deficiencies in different vitamins and more carbohydrates and less nutrients, particularly in wheat. So and I think access to fried food and processed vegetable oils, processed meat, processed wheat, all these processed foods over the time create free radicals in our body, and the cell age quickly, because as I discussed before, what we eat affects us at molecular level. So vitamin toxicity does exist, but vitamin deficiencies are more widespread. And I think we should as a family physician, I now treat when I see a suboptimal function, even if it's a low normal result. I would like to see it improve, and often I see that the patient symptoms improve as well.
You mentioned health span and genomic profiling. So how can genomic profiling, health span focus, build a healthier or more health resilient communities?
We are moving towards living longer. It's dependent on many things, particularly on our genes, which is luck based, right? But our lifestyle. But the concept is about living well. So on average, a person lives around 11 years with chronic conditions. So if we can do something about it, then our uh, quality of life will improve. So and that the years spent less with knee pain, and less with taking a lot of medications, and more with family or doing things that we like to do. So that's the concept of health span. UAE has exponentially increased the spending on healthcare, and we can see that the lifespan has increased accordingly as well, and that's fascinating. So you more you spend on healthcare, the more gains you get from the population, and that's an amazing thing from the leadership of the country. But then what means, if people are living longer, they have more chronic conditions, so they can be a burden of the on the healthcare systems. So what we want to do is we want to improve the health span. And how can we do it? So again, we have to go back to, so we've discussed all the lifestyle issues. We didn't discuss fasting, and because Ramadan is coming, so in between I will go off tangent. So fasting is key. Fasting is linked with longevity, and there's a concept called autophagy. So autophagy means that when we do not when we fast for a safe period of time, that's important, balance is important, then the body starts removing the cellular junk, the cells which are not functioning properly. The body will automatically remove them. It's called autophagy, and that means it's automatic renewal. So safe fasting. So fasting is not for everyone. Those with diabetes should seek, healthcare professions advice. But fasting, intermittent fasting, or fasting mimicking diet, so our audience can look into it a bit further. And that's also in moderation, not all the time, can actually gain a lot of health benefits, including detox. So if we can go back to the main question about health span, so we go deep into the cellular level again. So our cell has a nucleus has a DNA has chromosomes has genes on them. So genes are the code, like a software has a code behind it, and the codes will tell us what the software will do. Same thing is what our genes will tell us. So we inherit them, but the genetic changes happens with lifestyle as well, whether it's smoking, alcohol, excess, lack of sleep. So at ADSCC and Jas Clinic, we are really, really honored and privileged that we focus on that level. So all the interventions we do, whether it's cellular therapy, or we do other things as well. We will talk about them one by one. So at that level, there are many things that are happening, whether it's gut bacteria, whether it's a leaky gut syndrome, whether it's the genes have changed because someone is smoking for 10 years, or they had a poor lifestyle. So there will be many genetic changes which damage the DNA. And the DNA is kept by chromosomes are kept by a protein called telomere. And now we know that if the person is aging fast, these caps which are protecting our DNA, our chromosomes, are small telomeres. And anything that can help, the theory is that increase the health span, that means the telomere length can be reversed. So we have access to genomics. So genomics is study of the individual genes, and now we are fortunate to have access to it. So we do pharmacogenomics. So we see if the patient has certain genes which cannot be suitable for certain medications. So we can do a personalized prescription, and we have some examples. There was a patient who was on acidity medication for a long time, and they were not working, and we were using really fancy new ones. And we found out after a pharmacogenomic result that the basic one, the one medicine that we knew like 20 years ago, that medicine was the most suitable acidity medication for that patient, and the patient was switched to it, and the symptoms were much better. So we are applying pharmacogenomics. Then it's nutrigenomics. So now we can study about which genes can help. We have a specialized dietitian who is trained to understand the nutrigenomic data. So personalized diet care plans are given. So which foods patients can use, diet plans according to their genome really. And the most important thing is the polygenic risk score, or which diseases the patient has inherited, or there are some changes in the gene which the patient can have those conditions. So again, linking it to screening, then we can, once we do a genome study, we can then do advanced screening for those patients. Of course, this is advanced, this is more than the standard of care, but these things are happening. So again, the future is here.
Mm-hmm. That's fascinating. So now let's deep dive into your area of specialty, which is regenerative medicine. If you can take us through the simplest definition,
Okay.
and how is this applicable in today's world?
Regenerative medicine, as we discussed, is the ability, utilizing the body's own ability to heal, through cellular therapy, or, the growth factors we have in our plasma. So we use the body's own healing abilities to, treat conditions or for general well-being. So that is regenerative medicine. So basically, if we talk about stem cells, so these are the cells in our body that can, and there are different types of stem cells. These cells can transform into different tissues. For example, there is a type of stem cell that can make muscle, can make bone, that can, there are type of stem cells that make the blood cells. So there are type of stem cells within each organ that help healing within the organ. So nature has provided us with these stem cells. Stem cells normally, their home is bone marrow. Okay, so they live in the bone marrow. But when there is injury, there are chemical signals in the body. These signals, they talk to each other, the cells, and they ask for help. So stem cells are then deployed for bone marrow, and then they go in the area of inflammation. And for audience in general population, I mean, the basic understanding of how stem cells work is two main functions. So stem cells produce nice molecules that can reduce inflammation. Stem cells produce some proteins which tell other cells to work better. And stem cells can actually help stop the body attack itself. So immune modulation. So stem cells can improve the immunity, and they can modulate the immune cells. So for example, the first treatment of cellular therapy for type 1 diabetes was done at ADSCC recently. Of course, we are very careful in our patient selection, but we are at the cutting edge of medicine, and we are seeing some promising results. But this is scientifically based. There are trials that has already happened that show that the type 1 diabetes patients have body attacks its own pancreas. So you have these cells which can help reduce the bad cells which are attacking the pancreas and increase the good helper T cells which are going to help the pancreas to regenerate. Of course, this is still early, but it's quite fascinating that there is a lot of potentials in cellular therapy to help in many areas. I would like to mention here again, they were only organization in the world, I think, that has internationally trained physician taking ownership on their own specialties. So for example, the diabetes section is looked after by a highly trained endocrinologist from England. Same for each specialty, this owned by super specialists. So me as a family physician and a regenerative physician, we are part of one team, but we have clinical applications based on evidence developed in each section. For example, in orthopedic, stem cells have been used quite successfully, and in terms of evidence, there is evidence from really good quality evidence showing that stem cells can help with pain and reduce inflammation in a set group of patients. So that's really important. We as trained physicians, we respect the standard of care. Standard of care is what is internationally agreed in the guidelines. So we select our patients, we screen our patients, we have strict clinical protocols in place, and each treatment is given after clinical consensus and review of the evidence. And if there is something that we treat our patients and we monitor their outcomes as well. And I am really honored and privileged to work in an organization which has access to stem cells. So we use stem cells as a tool that can help the patient. So, but still the super specialists do offer the standard of care, the established medicine to those patients as well. But there is always a group of patients who have exhausted all standard of care, and there is nothing that can help them. And so we are doing, translational research there are trials ongoing. In fact, if we have time, I can talk about CAR T. So there is a condition called lupus. It's an autoimmune condition. So simply speaking, the body starts attacking its own, itself. The attacking cell is the T cell. So the first treatment was done in the Minna region at ADSCC. The cells were manufactured at ADSCC. Treatment was given at Yas Clinic, and basically the T cell is modified in a way that can help heal. So after genetically modification of the patient's own cell, the patient received the treatment and is doing well. So I think there is a lot of development in the last few decades. I think there is always, when we look at the evidence, it will always say that we need bigger studies. And it's one of those fields which now we know that some of the stem cells are very safe. There are a few that can have some problems, and they are not practiced in UAE. We don't deal with those stem cells, but the cells we used are, the safety is entirely established. For example, mesenchymal cell, they're established to be safe to use, and they're quite potent. How effective they are now, that in the world of evidence, needs really large studies, which is often in cellular therapy not possible. So cellular therapy can help, particularly in orthopedics for joint preservation, or at least in reduce the pain and inflammation. It can help, and for decades it's been used in aesthetics, so for reducing the signs of aging on the skin. We have a wonderful hair stem cell program in which we harvest patients' own hair stem cells from their hair follicle and the growth factors and PRP from their blood, and it works really well. Today we don't have presentations, otherwise I would have shown you the before and after pictures. So hair stem cells, orthopedics, we are going into type 1 diabetes, and then in one of our future projects is anti-aging and cell senescence. So the old non-working cells, how we can use young vibrant cells which are safe to be used to stimulate the whole body to start functioning properly. And that's a concept used in longevity called cell senescence. Old non-functioning cell which have stopped dividing, they are not working at their peak performance. So there is no single component. I think if I talk about as a highlight, that there is no single solution. So there has to be, lifestyle is the most key element, and then diet, exercise, sleep is important, and gut health is important, and then there screening, as we discussed. And in the end, I think there are latest scientific developments, particularly the field of genomics, cellular therapy, and then interestingly, recently we acquired our first hyperbaric oxygen chamber. So, and it's quite fascinating. So, hyperbaric chambers have been there for like almost 100 years, and they are used for treating many conditions, approved by Department of Health for 14 conditions. But if you look deeper into the evidence for well-being, it's an amazing tool. And as in regenerative medicine, we have learned that if someone takes 10 sessions in hyperbaric chamber, studies have suggested, of course we need more bigger studies, but studies have suggested there are 200% increased circulating stem cells in the blood after having hyperbaric chamber. So it can help collagen growth in the skin, it can reduce inflammation in the body. So we are, as I said before, holistic integrated care. So it's stem cells is our main specialty, and we are developing more and more expertise and expanding the clinical applications. But we are focusing on all of these other areas.
Beautiful. There is AI revolution happening now, and looking ahead, how do you think AI is going to support the health resiliency?
I have a really positive outlook on AI. And I think, I have learned how to use AI, and I'm still learning. And, with time limitations, there are so many clinical applications of AI, particularly in research, that can be happening. So I think AI is when, of course, it's with anything in life, you can put a positive and a negative light on it. And positive things can be, used negatively. A Ferrari can be driven in the wall, and it's not and the driver cannot say the car is bad. It's a driver's fault. So I think AI is very powerful. AI is going to revolutionize health. AI has the capability to integrate or instill operational efficiencies. That's a key for me. Operational efficiencies in organization. So data mining. So for example, if you've seen 10,000 patients and you want to have a meaningful data analysis, it can take a researcher years to just go through the data, but a reliable tested AI software can help augment that. I think There are some studies done, and there is some, an argument that AI assisted diagnosis can help in patient safety, but that is still, to be established. But I think, things like, note scribing, things like organizing things and supporting research, that can help. One thing I think AI can, as long as the information is accurate, because there can be errors in AI, it's still a machine, it's still a code, and it can generate, depends on how, your prompting was. And a wrong question can generate a wrong answer and can cause anxiety in patients. But AI can be used for health education in patients. And as clinician, I think we should embrace AI and understand AI, because our patients will be using it, with their symptoms. Everyone will be using, the different softwares that are available. So I strongly believe that, there is a positive role of AI. And the key point here is drug discovery. So there is a problem in science with protein malfolding, and there is very difficult to identify, cure for it. There is a problem with identifying, cancer cures. And there is a scientific community thinks that, because AI can help expedite research and answer, a lot of large data can be analyzed, very quickly. There is a possibility that AI can expedite drug discoveries. So in research, in organizing yourself, and I think basic information, it can help. But I think it's not because I'm a physician I'm saying it, but in these 15 years I've learned that, it's not, the patient is not a robot. Okay, we are humans. The human touch is always important. And there are subtle changes, especially in mental health. The patient may not have a good eye contact, the patient may be having severe depression, but at that first point they don't want to discuss it with you. So even for, there are certain times that everything is right, the blood pressure, heart rate, everything is right, but we feel something is not right. This patient, it looks very sick. So the human touch is important. The decision making on humans has to be through, AI. The AI can support the decision making, but the decision making has to be from a trained professional. Yeah. And I think that will never change. Surgeons have been using robotic, surgery for time, but you have to have a trained surgeon, where the patient who will trust their lives to be in human hands. So I think AI is the future. So, and it has to be embraced.
Yeah, it's a tool, but always you need a human behind it.
Yes.
Absolutely. Dr. Fazil, thank you so much. What would be your closing advice or the main takeaway for our listeners today?
Yes, so I'm really honored, and I'm really grateful for giving me this platform to speak to the community. Again, I'm very grateful to be in Abu Dhabi and work and live here. The built environment, I think it's amazing. I have seen the facilities, developed by the main real estate, in Abu Dhabi, is that we can see jogging tracks, and we see cycling tracks, and we see international cycling events, and there's a lot happening. So I would encourage that, to use those facilities, to use those parks, the green spaces that we have built in Abu Dhabi, particularly in winters, and there's a wonderful winters here. So I think what I would like to say is that, nutrition is the key. What we eat, how we eat, and when we eat it. So that's important. Always, carry on exercising, make it a lifestyle, make it a mandatory thing. Sometimes we don't feel like doing it, but I think it should be part of our daily regime. And then no matter how busy life is, screening is important, and do not miss the screening appointments with your doctors. It's important to have one long-term physician as well, and all your data in one place, and that helps consolidate the care, and it's much safer. We call it continuity of care. So and then I think those patients who are suffering from anxiety and depression, they should seek help, and it's and any physician did this. There are state of the art hospitals in in Abu Dhabi. So, or if you're listening from somewhere else, so seek help, talk to family members, talk to friends, and of course speak to a professional and gain some insight on how we can fight mental health illnesses. And supplements, I think most of us should take vitamin D regularly. And there are supplements that are linked with longevity, but of course, on case to case basis, we need to review. So, um, and um, and then for those patients who want to do something beyond, so something that that can help mitigate the poor lifestyle choices of decades, and genomics is available. There are infusions like NAD plus is available. Of course, evidence is emerging. So cellular therapy is an option for some patients for conditions as well. So, and then each patient is assessed on case by case basis. But overall, exercising, sleeping well, those things are key. And if we keep doing that, and then a bit of luck.
Thank you so much, Dr. Amir. This has been a great session. Thank you for sharing your expertise and insight.
We're still learning, still a student. Yeah.
Thank you very much. That's very enriching, and I learned a lot today, and I hope everyone who joined us did as well. My takeaway from this session is that seeking health resiliency is not a wish. It is an active thing that you do on day-to-day basis, and consistency is key. And again, Dr. Fazil, thank you for illuminating the path for resiliency. And
thank you very much. It's an honor to be here.
Hope to see you next time as well in
no problem.
more detailed sessions. Thank you very much.